Welcome to another episode of Girl Talk with Dr. King. I have Mrs. Tiffany James here today. She is an administrator, she has been a principal, and she talks kids all day, every day. But I'm so excited to have her here because today we're not talking about kids. We're talking about grown women. One day we were talking, and I don't know if it was one of our episodes, and you were talking about perimenopausal and that no one had shared what that even means to you and that they were a little shocked that you didn't know what that is. Tell me about that.
So, as we always discuss my young people and all of their options.
Yes.
I didn't have any of the options. I have really bad migraines.
Oh, okay.
So I wasn't able to take anything. So I've been rocking natural since the 90s.
And we're talking about birth control.
Birth control
Okay.
and very, very little medication at all you know, for anything.
Sure.
So when I turned the corner at 40
Yes, ma'am.
and started having all of these experiences that were abnormal for me,
Yeah.
I was like, well, I think this is, I did the Google search, which you're not supposed to do. But I said,
It's fine.
I don't think this is the time for menopause.
Yeah.
So, let me just let it keep going for a couple more weeks or months, which we have discussed. And I let things go too long. I'm thankful for my friend who will tell me, no, please go get that checked out.
Yes.
But when I did go to get that checked out, and I said, I'm having these hot flashes. My cycles are very irregular now. All of these other things that were happening. I said, but it can't be menopause. They said, oh, no, it's not menopause. It's probably perimenopause. And I was like, I'm sorry, what? What is that? And they explained that it's something that happens before menopause, but it's basically all of the menopause symptoms.
Yes.
And I was offended that there wasn't a pamphlet that was made available to me
About perimenopause.
about that way earlier in life.
Yeah.
Use the time when I had my son, as a moment to capitalize on and say, hey, so this is what's going on with you now. You have all these other childbearing years left, but in early 40s, this could happen. No one said that to me.
Yeah.
And so when I said, and I'm waking up in the middle of the night and I am very hot and I cannot get cool.
Mm-hmm.
It didn't register that this was a disturbing change for me. It was like,
Gotcha.
oh, it's perimenopause.
Mm-hmm.
I'd never heard of that before.
Well, as you were an English major, I think, right? So the
English
word
teacher.
English teacher.
Yes.
What was your major?
Education.
Education.
Yeah.
Okay. So I feel like you can teach everything.
I can teach everything.
Okay. So as an English teacher, the word peri means around.
Mm-hmm.
So perimenopausal means exactly that. I'm around menopause, but I'm not in menopause. Okay. And if we truly had the definition of menopause, it means 1 full year without periods.
That's right.
That's all it means.
Yeah.
So the symptoms that happen before and after does not mean that that's menopause. So the average age of menopause is 51. But as an educator, the word average means some before and some after. Now, sometimes you pattern your mom. My mama has been flashing since I've known her. And I'm like, I can't pattern that. First of all, Mom, no, you are literally not still in menopause, right? I had a conversation with Dr. Stewart. I don't know if you met her. And I was telling her how my mom had a hysterectomy really early. And they took her ovaries. At the time, they took her uterus and ovaries and everything. And so she probably was flashing way back in her early 30s. But my mom is in her 70s. And she'd be like, woo, I'm hot. Mama, maybe you need to go get that checked out. But that being said, there are symptoms that can happen around menopause. Sometimes you can have the hot flashes, which could be different than night sweats. Mm-hmm. Okay, flashes can come at any time.
Yes.
Literally, you're like, oh my God, I'm wet. Hair drenched, all the things. But night sweats sometimes can only happen at night. And it's that covers on, cover off, covers on. Okay. And then when you truly have been in menopause for a full year, it doesn't mean that those symptoms go away. Not right away. Not right away.
The birds.
So we call those symptoms vasomotor symptoms. Okay. And so when we start talking about treatment options, it could be various different things. For me, I like to start with behavioral things. So for my menopausal women, I say dress in layers. So you can always take something off because you never know when it's going to come. The other thing is sleep with a fan by your bed. Now, my husband sometimes, and I'm not in menopause, but I do have night sweats. And just to be very transparent, I've been having night sweats since my 30s. But my husband is wrapped up like a burrito. And, and I'm on the side with a fan. Well, I need to have a fan, but like a circular fan. Also to avoid hot and spicy foods. So my women who love a cup of tea every morning or coffee every morning, avoid spicy foods. Those are some things that can help you like behaviorally. Okay. The other thing that I think can also be helpful is sometimes to talk about medication. Have you heard any negative or positive things about?
Yeah. So, I mean, word on the street, you know, if you are not in the medical profession, is word on the street is you do not want to mess with these hormones.
Yeah.
You know, you
Yeah.
want to stay away from them at all costs.
Yes.
And then, as I shared in the beginning, someone like me who, you know, as soon as I tried to do anything to regulate my cycle,
Yes.
after I had my son, the migraines becoming way worse and doing all the blood work and finding out like you cannot have any of these things.
Sure.
I'm like, that might not have been an option for me.
Right.
So a lot of the things you mentioned were things that I had to try to do and do very poorly because I love
Yes.
spicy food. I love the coffee.
Yes.
But I don't know enough about the medication because that wasn't the route that I
Yeah.
chose.
So I'm glad that we are talking about this because hormone replacement therapy, HRT, got a bad rep a long time ago with something called the WHI study, which showed that it could be more harmful than we thought. Okay. And so we only prescribe hormone replacement therapy for the shortest amount of time and the tiniest dose. We would want you to consult your doctor to see what your risk factors are. But the take-home message is, and this is only for vasomotor symptoms, so only for that hot flash. What we didn't talk about is vaginal dryness. We can come to that too. But shortest amount of time, the smallest dose, okay? Now, people who sometimes have had risk factors for not being able to take birth control may have similar risk factors for not being able to take hormone replacement therapy. So it's a thing. Heart disease is the #1 killer in women, especially over the age of 50. And we know that hormone replacement therapy can increase your risk of heart disease. We go through your history, really important to say, okay, you are a candidate and you're not a candidate. So I say, don't be fearful of it, but just have a conversation with your doctor to see if you're a candidate for it. Okay. The other thing is that sometimes patients have vaginal dryness, and sometimes you can just get a local estrogen, which means like estrogen that you could put in the vaginal area or inside the vagina that could help that. Okay. And then we also have non-hormonal things that can help. Over-the-counter things. Sometimes I would have patients and they can have some that can stimulate that vaginal lubrication for them that can be helpful. Sometimes patients don't want to have that conversation, especially if you're over the age of 50 and you're like, I mean, I haven't seen a GYN in this long, and why is this young person talking to me about my vaginal health or talking to me about sex? Because that's my job, you know. The other thing I'd like to tell patients is that when we start our period, certain things happen. And when we end our period, certain things happen. But it's natural. It's not like something bad is happening. And it's not like we have to be fearful of the almighty menopause, right? You can still have a normal sex life. You can still be a normal person. And the other thing that I didn't have a chance to talk to Dr. Stewart about was that sometimes we give antidepressants to treat menopausal symptoms.
Oh, really?
And I'm not treating you for depression. And so I tell patients, I'm not calling you depressed, but you know how sometimes we can have off-label medications help us. So sometimes, I mean, your mood gets better and that's fine. So I'm just excited that we're able to have this conversation because a lot of times people do not want to talk about menopause.
Oh, no, it's a necessary conversation. Came as a shock to me. The hot flash was my big symptom and I did not know what to do with it. But I recognize that that's what it was because it is well named.
Well named, right?
Yes.
Yes. So thank you for joining me.
You.
I want to thank you all for joining us for this segment of Girl Talk with Dr. King. Menopause is something that you do not need to be afraid of. It's coming for all of us women, and it's okay. So just remember that if you have questions about, are you a candidate for hormone replacement therapy, to talk to your doctor. And again, thank you for joining me with Girl Talk with Dr. King. Thank you.